Disease cluster investigations, I think especially childhood cancer cluster investigations, are inherently unsatisfying and difficult. And the reason I say that is because often, as it was in the case of Woburn, it's a fairly small number of cases that are at issue. And in this instance, it was in East Woburn 6 cases. So it would be really difficult from a statistical power point of view to get a meaningful result in any kind of a study where you were focused on 6 cases. So that's one limitation. And the other is the obvious one, which is what are the exposures, and do we even have information about the exposures that can be associated with this outcome? And often the exposure information is either not there, or if it was there, it's gone. And so you have to try to find historical records. People's recollections may be faulty as to what was in the environment or in people's homes, for that matter, years before. So for both of those reasons, a small number of cases, the difficulty in identifying exposure information, cluster investigations, even if they are done with what are then state-of-the-art methods, which this one was not. The original cancer cluster investigation in East Woburn was based on just kind of finding one's way without much prior guidance, without many examples in the literature and in the the epidemiology textbooks. So that's how it started. And then subsequently, there was information about water contamination. The Department of Environmental Quality Engineering in 1979, this is really after the main calls for some kind of an investigation had already been lodged, and an initial case control study was already underway. DEQE tested the water that was in these 2 wells in East Woburn that were closest to the 6 cases, the initial cluster, and found that they had significant elevations of 2 solvents, in particular trichloroethylene, but also perchloroethylene. So that became then the focus of, well, is there something that we can do to model who was exposed in a case control study, who was exposed to the water from these 2 contaminated wells? So then it got a little bit more scientifically, I would say, satisfying. And even after that, there was a study done by Lagakos and colleagues at Harvard School of Public Health that incorporated the water model, the initial water model, and did find an association, statistically at least, between exposure to contaminated water from wells G&H and subsequent diagnosis with childhood leukemia and other childhood illnesses and even adverse birth outcomes.